Welcome, everyone, and thank you for joining us tonight for this important discussion. We are all aging. What does that mean for social workers? Just a reminder that we are offering 1.5 continuing education credits for tonight's program. In order to receive full credit, attendance is required. You'll receive additional information by email following this event. We would like to begin tonight's conversation by acknowledging that the land on which we gather is the territory of the Mohegan, the Mashantucket, Pequot, Eastern Pequot, Schaghticoke, Golden Hill Pagusset, Nipmuc, and Lenape peoples who have stewarded this land throughout the generations. We thank them for their strength and resilience in protecting this land and aspire to uphold our responsibilities according to their example. I will now turn it over to Milagros Marrero Johnson, Director of Strategic Programming, who will share a few remarks on behalf of Dean Heller.
Good evening. Buenas noches. On behalf of Dean Nina Heller, who unfortunately cannot be here with us, I would like to welcome you to tonight's program. Given the critical need to develop a workforce to serve the growing number of adults aged 65 and older, not only in Connecticut, but across the nation, the School of Social Work established the Scholars in Aging program in fall 2022 through the generosity of a longtime donor. This important and timely program provides students with specialized classroom and stipend-based field training to serve the growing number of adults aged 65 and older within diverse communities and institutional settings. A social work and gerontology lecture series, as is the case this evening, small seed grants for practice-based faculty research with older adults to enhance service delivery and to highlight potential areas of need, and sponsorship of continuing education programs in the area of aging for practicing social workers. We hope you enjoy the program and look forward to you attending our future events. At this time, I would like to introduce Dr. Rupal Parekh, School of Social Work Assistant Professor.
Thank you so much. Share a PowerPoint here. Hi, thank you so much. It's wonderful to be here today. I am going to talk about some of the demographic trends and what that really means and as Milagros said, in the US and particularly in Hartford, and what that really means for social work. So currently there are about 36 million people aged 65 plus in the US, which is approximately about 12.4% of the entire population in the US. This population group is expected to more than double to 86 million by 2050. And there are several reasons for this. One of the major reasons is that ethnic minority elders are the fastest growing populations, one of the fastest growing population segments in the US, as well as what we call the oldest old. And these are individuals that are 85 and older. Basically, what we're seeing is longevity. People are living longer. We're also seeing our immigrant populations aging, particularly Latinx or Hispanic older adults and Asian older adults. And of course, what we're going to talk about today is that social work is a key discipline in responding to geriatric healthcare and social service needs. Oh, okay. So this slide, it's a little cut off, I apologize, but it just kind of shows you if we're looking at 2014 to 2060, what the projections are for older adult populations. As you can see, Black, Asian, Hispanic older adults are going to more than double. And white older adults are actually decreasing in number, so from 78 to 58%. So we're really going to see some unique needs, and as social workers, I think we're best positioned to respond to these unique needs. In Connecticut, we have about 823,000, over 823,000 people aged 60 and older, which makes up 23% of the state's total population. That's today. These statistics are from 2021. So think about the projected numbers and how it's going to impact Connecticut. Connecticut's population today is the 7th oldest in the nation, and that's measured by median age. So compared to other New England states, Connecticut's population of 65 plus includes a higher percentage of Black African-American older adults, 6.8%, Hispanic older adults, 5.8%, and other races, which is 2.6%. Now, again, this is comparing to other New England states. So the density of the population age 65 and older in Connecticut, you can see that there's some counties that really stand out, Hartford being one of them, which has a high density of older adults, Stamford, Bridgeport, New Haven. So if you see some kind of differences in the numbers here, it says state total here, 587,580 compared to the 800 number that you saw earlier. For those of you that are paying attention, you might pick up on that. That's because this is looking at 65 and older, where the other statistic was looking at 60 and older. One of the things that I think it's important to sort of point out both, because what it's telling us is that there's a large number of percentage of the baby boom population that's part of the older adult population. If we can count 60 and older, and when we look at the projected numbers, of course, they're going to be counted in that number, of course. So I think it's important to share both. Also, different groups define older adults differently. For example, in the homeless older adult population, we can start, I believe the Department of Homeless Services, I think it's 50 and older, because you could imagine if you have any length of stay living that without a home, homeless, then you likely would advance aging for you. Okay. So in the state of Connecticut, we also see significant income and housing disparities. So on one end of the spectrum, 24% of the state's 65 plus households have an annual income of $100,000, and 25% of those folks are still employed, or 25% are still employed, not necessarily of those folks, but 25% are still employed. At the other extreme, 7% of older adults live in poverty, and 11% rely on supplemental nutrition assistance for food. What we also know is that we have a significant number of people that are socially isolated, especially when we think about immigrant populations and older adults of color. And I think that what we know is that not everybody accesses assistance. And so there's likely a larger number that would need assistance in nutrition and other services that we're not seeing here in these statistics. 77% of 65 and older persons own their own home in Connecticut, but there's also really huge disparities here. In Hartford, only 37% of older adults own their own home. And as we know, one of the kind of primary ways of building wealth is owning your own home. So, you know, when we see these disparities, it could be alarming in our own state. Over 30% of older adult homeowners are considered to be in the state of Connecticut are considered being housing cost burden. And that means that they spend over 35% of their income on housing. And Connecticut communities, here, this is a table that I thought was really interesting, shows some of the best and worst rates on selected indicators. And you can see Hartford and Bridgeport really stand out here as far as worst indicators on, these are mostly health indicators. So Alzheimer's, depression, flu shot in the past year. And just to be clear, these statistics are based on comparing them to the overall state statistics. So you can see that, you know, Bridgeport and Hartford, where we see most of our ethnic minority populations, or a large portion of our ethnic minority populations in the state of Connecticut, have, you know, worse rates on selected indicators. This is an infographic that I found online that I thought was really great. You can actually find this if you're interested in sharing this with friends and colleagues, just because you want to, or on Facebook or on Instagram, because you should. Connecticut, this is the Connecticut Healthy Aging Data Report. And what you can see here is they were able to collect, this is data from 2021, so it's very current, 190 indicators for every city and town in Connecticut. And you can see that there's been, well, they point out here that, yes, we have, significant health disparities and in Connecticut and based on race, but they've been really exacerbated since COVID-19. So I think this data is really, really important. You can also get some really neat data reports here. You can download your own community profile. You could read the highlight report to understand how your community compares to the statewide trends. You could also learn about programs and resources for older adults on myplaceconnecticut.org. And then they give you really great and creative ways to engage your community, how to be a part of the age-friendly movement, which I'm very passionate about, but unfortunately I don't have that much time to talk about it. But I think you can be really, sorry, I have lots of screens and I need to stay on one, but interesting to learn about that. And give you ideas on how to act, and they update current legislation on older adults. So I do recommend, going on this website and using these resources to learn more about older adults in Connecticut. So why is this important to social work, or why are social workers well positioned to do this? I won't have that much time, Milagros, if you can give me time, but we're, we use a strengths-based perspective. So social workers really believe that older adults and all people really have the power to grow and change. So the social worker's role is to help older adults identify strengths, resources, and goals. We connect the older adult with person and community resources, meet those goals, and facilitate and coordinate the process if necessary. We also are in a person and environment perspective and a life course, which we understand that, folks start aging the day they're born, and all those experiences throughout their life really make up who they are. And so that's the unique perspectives that social workers have. So we're well positioned to work with older adults. Also, social workers work in the continuum of care for older adults, and so, or of healthcare. So continuum of healthcare are designed to meet the diverse care needs of older adults. Geriatric medicine, geriatric social work, along with geriatric medicine, which work in interdisciplinary teams, has developed multiple models of care delivery for older adults. So this model is really about the person, an older adult, and how they kind of move along the continuum of care, meaning there might be independent in their home. They may have needs later in their life where they might need, some sort of hospital, acute hospital care, potentially home care and assisted living, rehab, a nursing home, and hospice, essentially for patients with a disease or any particular illness. This covers all the phases of illness from diagnosis to the end of life. And social workers show up at all these settings. Really, they're part of the interdisciplinary team most of the time. So why do we need a continuum of care for older adults? What we know, the research tells us, is that more than 35% of hospitalized older adults undergo 2 or more transitions of care in 30 days before discharge. So it's important for geriatric professionals like social workers to be able to discern which services are needed when and under what circumstances. So this landmark paper that I suggest you read, feel free to reach out to me if you need this article, but Caring for Older Adults, the Future of Geriatric Medicine. It really does talk about social work's role here, and it emphasizes the amount and complexity of care that older Americans will require in coming decades, and how the US healthcare system should change to accommodate that reality. I think it's really a landmark paper and worth reading if you have the time. So social workers are, like I said, in all of those settings, and we are interprofessional care teams across the continuum of care. So social work is often the glue that holds the continuum of care together. Integrated care cannot happen without us. Social workers provide these important linkages across the healthcare setting and providers. In acute settings, they often provide psychological support to the family system, patient, necessary interventions and discharge planning. And in outpatient settings, community-based providers work with social work case managers to identify and treat patients with high-risk psychological needs that may affect their ability to manage their care in their home or other setting. So here's just a little kind of visual for you to see the continuum of care and social workers. I mean, really, I didn't talk about myself, but I have really worked across the continuum of care, and I've worked in most of these settings. So obviously I haven't had a job for more than a year and a half, but I keep moving because I'm just so interested in aging and was so interested in working across the continuum of care. And so there's, just tremendous amount of opportunity for social workers. I tell my students that you will always have a job if you're interested in geriatric social worker. And our research tells us that once you go into aging, you stay in aging. It's really has been fulfilling for the social workers that have gone into this area of clinical practice or research, or even on the, in other areas along the continuum of care, or even other areas of practice, policy practice, and macro practice as well. All right. Okay. So that's just a little overview. Now we are going to introduce our special panelists. We have today with us Tina Jefferson. She is an MSW, and she works at the State of Connecticut Department of Children and Family Services. She is also a UConn alum and has served as a field instructor. Thank you so much for that, because that's a lot of work. Then we have Lara Stauning. She's a JD, staff attorney at the Department of Aging and Disability Services. She's also the State Unit on Aging co-chair and the Coalition for Elder Justice in Connecticut co-chair. We also have Rachel Boxwell. She's an LCSW, and she's a social worker at UConn Health. So thank you, all of you, for being here today. I'm going to kind of start off with some questions, and I think, some broad questions, and then we'll kind of go into more specific questions. So Tina, if it's okay, we can start with you. All right.
Absolutely.
Okay, so can you give us an overview of your job and focus in on the work that you do with older adults and services for older adults in Connecticut that your agency organization provides?
Absolutely. First of all, I'm really thrilled to be here this evening. So I've been with the Department of Children and Families for 28 years and counting. And I started as a frontline social worker and pretty much worked my way up through the ranks from social worker to supervisor. I spent some time as a child welfare trainer. I was the office director in the Hartford regional office. A regional administrator in Region 6, which covers the New Britain, Meriden part of the state. And I've been in the role of Bureau Chief of Child Welfare for the last 4 years. And in this role, I'm responsible for operations of the 14 area offices, the care line, which is our front door, and the foster care division. So when I think about our older adult population, it's about keeping children with kin. And a part of our, at any given point, half of the children in our foster care system are living with their kin or people that they know. And the vast majority are their grandparents, their aunties and uncles, not, their great aunts and great uncles. And so it's imperative that we pay attention to the older adult population and what their needs are.
Thank you so much. Are you frozen?
No.
Oh, okay, great. Thank you so much, Tina. And I think we have a lot of questions, and I'm going to kind of wait till the end. So I just want to remind folks, or I actually want to let folks know that if you have any questions, we're going to hold those to the end. Please use the chat to put it down, any questions, and then we'll have a time for Q&A at the end. So I'm just going to go through each of the panelists. Rachel, maybe you can go next. Do you want me to repeat the question?
Oh, no, that's okay. Thank you, though. Thank you for having me here as well. So as you had said, I'm an outpatient clinical social worker at UConn Health, and I specifically support our geriatric clinic. So my role is working not just with our elderly patients, but with their families, their caregivers. And it's a unique role because while I have worked in hospitals and nursing homes and in home care, I now have the pleasure and the ability to work with folks across the gamut. So that continuum of care that you were speaking of, I guide them through that process from when they begin with a geriatrician or they first receive that diagnosis of dementia. I work with them and the family to look at the different resources available, figure out what is best for them based on their preferences, their needs, and help them kind of navigate that. Aging is so unique because until we are there or our family member is there, we're caring for them, we're not exposed, right? At any age, one can become homeless, one can experience issues with cancer, different things like that. But aging is incredibly unique. So frequently folks don't know what is out there and they try to manage on their own. So my goal is always to help them see the gamut of resources available to them and help them choose the right one for them and support them throughout that process.
Thank you, Rachel. And then Lara?
Sure. As you mentioned, I'm not a social worker, but I'm an attorney. And I have a background working with older adults my entire career. When I was in high school and college, I worked in a nursing home. When I graduated from UConn, also a UConn alum, I worked at Connecticut Community Care, which is a organization that provides home and community-based services for individuals living in the community to avoid institutionalization, going into a nursing home. And I decided while I was there that I wanted to go to law school. And I actually, that's another good area for social workers to go into. And I know that UConn offers a joint JD and MSW program. But I ended up going to law school. This is the area that I wanted to work in. I've stayed in Connecticut and I worked for the Center for Medicare Advocacy for several years. And then I worked for Elderly Protective Services with the Department of Social Services for about 13 years. And now I work at the Department of Aging and Disability Services. So even though I'm a lawyer by trade, I work a lot with older adults on a wide variety of issues. So for example, just to kind of show, Tina and I haven't ever met, but the State Unit on Aging, which is the unit that I work for at the Department of Aging and Disability Services, is sort of a gatekeeper for funding that comes through the Older Americans Act to fund programs for older adults throughout our state. And one of the programs that we fund through the Older Americans Act is the National Family Caregiver Support Program, which provides services for grandparents caring for children. So sometimes we have interactions with DCF. And then I've also been working with Hartford Healthcare at the Center for Healthy Aging. Nancy Becker over there I've been working with. So I work across a lot of different disciplines. One of my roles is to co-chair what's called the Coalition for Elder Justice in Connecticut. And really, this was something that, we try to work on collaboration, getting these relationships built and working on various projects to help older adults in the community as they arise.
Wonderful. I just wanted to say for our people attending, if you do want to ask a question, submit your questions, and it gives you a choice of who to submit to. Submit to the host and panelists so all of us can see, and then we're going to deal with some of those after a couple of general questions. Thanks.
Okay, well, Tina, I'm going to start with you and just ask you some specific questions about your work. And you did mention a little bit about this, which is what I would imagine you would talk about today, is grandparents raising grandchildren. And you really do have this amazing history. I really enjoyed reading about you with the Department of Children and Families. And it sounds like you're in charge of a lot. So although your work focuses on children, you mentioned that you work with older adults as foster parents, and especially kinship care foster parents. Can you tell us a little bit about this group and some of their unique needs, and how DCF programs serve them? And yeah, great.
Absolutely. Let me first say, Laura, glad to make the connection. We should definitely talk after this webinar. But yeah, it became extremely apparent as we started to increase our focus on kinship care at the department, that most of the time we were leaning on grandparents and folks that were a part of the older adult population. And right from the beginning, it was clear that we were dealing with adults that were in poverty themselves or on fixed incomes, where housing was a challenge, where grandparents are in elderly housing that's subsidized, and we're asking them to take on 3 of their grandchildren, and it goes against the rules of the housing programs where they reside. So many of them we're struggling with having to choose between, do I stay in this subsidized housing or do I lose it in order to take on my grandchildren? Fortunately, I want to say in Connecticut, which is not the case in every jurisdiction, we pay our kinship parents the same amount that we pay our core or non-related foster parents. Which is, I think, significant in Connecticut because many of the grandparents prior to our ability to do that would have to go to TANF and would have to, be relying upon assistance from TANF and food stamps. And so it helps a lot that we're able to offer the stipend. As Laura mentioned, we do have a caregiver support team services, and they work with families to try to meet their needs, to try to help them navigate not only our system, but other systems. Many of our families also come through probate court. And so sometimes there is a need for legal assistance or being able to navigate, what petitions they would need to file on behalf of their grandchildren. And quite honestly, many of our families are just struggling with basic needs. And so it's a matter of, where can they go for food assistance? And obviously, it's imperative that they remain healthy in order to be able to care for their grandchildren long term, because it's not uncommon to place an infant with a grandparent who might be already over 65 years old.
Thank you so much. This is so interesting. I actually just recently submitted a paper on grandparents raising grandchildren, and some of the data shows that, really good outcomes with grandparents raising great grandchildren. I'm sure, Tina, you're familiar with some of that research and some of that work, and you're doing that work on the ground. So thank you for sharing. It's so interesting. And again, go ahead, Tina.
Oh, yeah, I neglected to mention, and this is an area where Laura, maybe not you, but definitely somebody from the Department of Aging is working with us, because we're in the process, and it's very exciting, of establishing a kinship navigation program. And that program, we are hopeful will be able to be kicked off over the summer, but it's a part of our larger prevention plan and our family first work that we've been able to do in the department. And that program is being informed by parents. So we have a caregiver council, we have foster parents, we have different state agencies at the table, we have 211 at the table, we have the probate court at the table, and they've all informed this program based on what our caregivers, our kinship caregivers say that their needs are.
And one more follow-up, just quickly, can you tell folks exactly what the kinship navigate? I mean, I understand, you'll have more knowledge than I, but I'm familiar with it, what the kinship navigator programs do. What their purpose is.
Yeah, absolutely. So they're going to be able to do a needs assessment with the family when they first meet with the family, and really it's going to be caregiver led, and it's think about it as somebody sort of holding your hand and walking with you and navigating all of these various systems that may be completely unique to you. So they can help with navigating assistance with housing, assistance with legal, assistance with basic needs, assistance with childcare. That's another huge one. Because as you indicated in your stats, many of our grandparents, they're still working. So they can't afford to stay home like maybe grandparents from years ago and just raise grandchildren. They have to go to work. And so they need childcare. And when children are first placed by our department, most often it's like flipping a light switch. I always say it's not the same when you are a core foster parent and you've gone through maybe several months of training in an application process and you've prepared yourself for that child, coming into your home. Our kinship caregivers usually just get a phone call, and in one day, your life completely changes and you have all of these systems to navigate because of course you want to be there for your grandchild, but you might not even have a bed. You might not have a room. So there's a lot of work that we know that our kinship caregivers need that are unique to kinship caregivers, because unfortunately in the past in our society, many people felt like, well, if you're kin, you should be fine. We should just be able to give you your grandchildren and you shouldn't need any help. Well, that is not reality.
Thank you so much, Tina. That's really helpful. Thank you for all that detail. Rachel, so I have a question for you. And you mentioned this as well, but can you tell us the kinds of things that you do to help patients and families navigate the continuum of care? So basically getting from one type of living or care situation to another. And if you have an example of a particular client or patient that you've worked with and you want to share that with us, feel free.
Okay. So it really varies from person to person, depending on their needs, right? But where it all starts is the fact that, kind of as I referred to earlier, a lot of folks are in the dark of what's out there, right? So folks think of nursing homes as the only option when they're not familiar. And so they will, for lack of a better term, suffer in silence. They will serve as the primary caregiver. They'll take care of their family member at home and not ask for help. And there are so many resources out there. So I first sit down with folks and kind of really break it down. What are you struggling with? What are your needs? And really take it step by step. Things that I may identify for someone, as hearing their story and their experience may not be their concern, right? So I really let them kind of talk it out, hear where their concerns are, and explain to them the gamut of services that exist. So Connecticut is amazing in what we offer. We have the Connecticut Home Care Program for elders, which I had worked for many moons ago. That their goal is to, right, Lara, to prevent institutionalization, right, to keep folks in their home, keep them safe. We have the Connecticut Respite Program, which can also support folks if you're not eligible for the home care program. We have the Money Follows the Person, the name escaped me for a moment, which can help folks. You go into short-term rehab, you end up there longer than you expect, and you lose your home in the community. Housing is such a challenging issue for across the board in Connecticut, but especially for our elders who need affordable housing, accessible housing, and in very specific areas, right? They can't be as flexible with where they reside when they need to be near doctors and hospitals. So I'm able to help connect these programs to folks and really explain it, make it accessible. When folks do a Google search, it's hard to know, is that program for me? What does it actually do? And then depending on the person, it varies what I do next. Some folks, families or the patient themselves are happy, the information, the referral, and they can run with that. Other folks need a bit more assistance. I have, so I do have consultants that I will refer to in the community, whether that's for assisted livings, for nursing facilities. So I love to connect folks together, but also guide them myself. So I'm very connected to the resources in our community and network with them frequently, so I can share with folks, this is appropriate for you, whether it is for the amount of funding that you have, the challenge that you have, whether cognitive or functional. And most importantly, I help families figure out what's best for the overall family picture, right? So my favorite part of working with elders is that I am not just guiding the elder, but frequently the entire family unit. So you're not only easing the transition and this big change for the elder, maybe moving from their own home where they've lived for the past 50 years into assisted living. But that's a big change for their adult child, right? For their family. Maybe that person's role was the primary caregiver, or that's their childhood home, and the picture they have of mom. So while it's a lot of connecting folks to resources, explaining programs, and helping them choose the right level of care, it's also a lot of support and helping ease that transition, coping strategies, and connecting folks to the right support groups if they need it. Really hearing what they need and trying to connect them as best as possible.
Wonderful, Rachel. I've had that job, and it's great work, and what wonderful connections you make with families and older adults. So thank you for sharing. It was really comprehensive. Lara, so a specific question for you. Can you tell us a little bit more about your role as co-chair at the Coalition for Elder Justice, or even if you can just tell us a little bit about how the coalition works with elder abuse prevention, I think might be an interesting for folks here to learn more about.
Okay. So the Coalition for Elder Justice in Connecticut is an organization that was established under an executive order issued by Governor Malloy. And the purpose of that, the coalition, is to build partnerships within both state agencies as well as private entities. So we have a steering committee that's made up of a wide variety of disciplines from both an equal number of state agencies and private entities. In other words, we have elderly nutrition providers, faith-based leaders, Center for Healthy Aging from Harvard Healthcare is one of our members on our steering committee. And then we have a lot of the state agencies that do a lot of work with older adults, Department of Banking, the Attorney General's Office, State Unit on Aging, Department of Social Services. Those are just a few. And so the goal of that is collaboration between those entities to better serve older adults in the state. And, in my experience working as an attorney, working for the Department of Social Services, representing the social workers in probate court is, I always found it sort of frustrating that there wasn't a better network of support for each other, because I found that while the social workers couldn't do everything that was necessary, neither could the individuals who were working in the community. So for example, we worked sometimes with law enforcement when we were dealing with elderly protective services. And there wasn't that connection or that relationship there with law enforcement. So law enforcement would go into a situation, but they wouldn't realize that there was a social worker involved, or vice versa. So we needed to get those two entities to talk to one another, understand each other's roles so they could help each other, and then better serve the individual. And once we were able to do that in a lot of cases, like we'd have multidisciplinary team meetings in really complicated cases, it was a better outcome for the older adult. And even though I'm not working with protective services anymore, I've really, one of my passions or my focuses is to continue to build that relationship with law enforcement, because I think there's such an important piece of working with older adults and responding to elder abuse. So we are planning. So an example is that I have made a connection with law enforcement. I'm working today. I worked with a state trooper on a cryptocurrency bill that he wants to propose on behalf of his or on behalf of DASP, the Department of Emergency Services and Public Protection, that addresses cryptocurrency, which a lot of older adults are falling victim to, and that's a form of elder abuse. So we've built that relationship. I'm working with the Connecticut State Police to develop a training as part of a new training recruit training portion about elder abuse. It's never been part of their curriculum before, and they're adding it as a part of their curriculum because, police are going to come in contact with people who are older, or they're going to come into contact with a person of any age, and maybe they walk in and see something that's alarming or concerning, and they're not social workers. So they need the social worker to go to and say, hey, I saw this situation. How can you help? Or what should I do? So I really think, building those relationships and those sort of multidisciplinary teams, even if it's just two people, two different disciplines, you can really work together and create a much better outcome for older adults and their families.
Thank you. I have a follow-up question. So you talked about some of the legal issues older adults are experiencing, like the crypto. It's fascinating. I had no idea that was something that was happening here, probably everywhere now. But what are some of the other legal services or legal issues older adults in Connecticut generally need?
Well, two of the big issues that seem to be arising right now are around housing. That's and I think that's affecting everyone. But it is particularly devastating for older adults who have been, say, living in an apartment for a long time, and their landlord decides that they want to up their rent. And maybe that wouldn't have been such a problem in the past because we have a housing shortage, and housing is very expensive if you're on a fixed income. It's very difficult to find adequate housing for older adults, and kind of dealing with the legal process that happens if they get a notice to quit. So I know that our legal services organizations throughout the state, who I've also worked with, are working on a lot of housing issues and eviction issues. So that's one area that's really concerning right now, because then it leads to individuals becoming homeless. And we've heard from the Connecticut Coalition to End Homelessness. We've worked with them a little bit, and they're telling us that a larger percentage of their homeless population are now older adults. So that's somewhat alarming to us, because that wasn't the case previously. They were more seeing individuals who are younger and have children. Now they're seeing older adults. The other area that I think we need to have more advocacy in, and this just isn't from attorneys, but also social workers can be advocates, is in skilled nursing facility settings. Everybody's heard, that the conditions in skilled nursing facilities are not what they should be. My co-chair on the coalition is Mairead Painter, who is our long-term care ombudsman for the state. And she is a real bulldog, and she's doing a fantastic job with what she's got, and she's relentless. Hasn't stopped throughout this pandemic. I'm really proud to have her as a friend and a co-worker. But more needs to be done around skilled nursing facility care. I think because of the situation in skilled nursing facilities, individual rights are being compromised. There is a patient bill of rights for skilled nursing facility residents, and that's not being respected by facilities in a lot of cases. And so people who are in facilities, or who have family members who I think Rachel was saying before, that I can understand this, until you have your own older person to care for, you're not exposed to it. It's like someone saying to you, here's your baby, you have to go home and take care of your baby for the first time. But it's that sort of thing, like you go, okay, what do I do? And there's all these resources available out there, and you're being told, that you have to move your older person out of the nursing home because maybe there's a behavior issue, or you need guidance. And I think there's some level of advocacy that can be done there that has slid back a little bit. And it's very difficult, because there aren't a lot of resources with our legal services throughout Connecticut. They're limited as well. So we're trying to really work with conservators and family members to educate them on what their resident rights are, and so they can advocate for themselves as well.
Thank you, Lara. You mentioned the skilled nursing home and the resident Bill of Rights. And one of the other issues that really came out during the pandemic was the number of social workers in nursing homes. And the Connecticut NASW put forth a bill that would increase the number of social workers in skilled nursing facilities. So previous to the pandemic, there was one social worker for 120 residents, which I was a director of social work in a nursing home. That is just not right, and you can't do the work. And so now it is one social worker for 60 residents. However, I think there's some implementation issues happening right now. What I've heard from some skilled facilities, it hasn't really been enforced quite yet. So not a lot of facilities are moving on that like they should. So this is a real challenge, because when we talk about resident Bill of Rights and we talk about those things, social workers are we're the ones that are doing that work. And when we don't have enough social workers, and a lot of the time we're discharge planning, It can be challenging, but I'm hopeful that there's change in our state, and there has a bill that's been passed. So likely by the time we all get out there, or a lot of us that are on the call today or on the webinar today and that are interested in working in skilled facilities, we'll see change there. 1 in 60, is wonderful. Connecticut will be a leader among other states, if we can really have 1 in 60, one social worker for every 60 residents.
And that's one thing that we should be really proud of in Connecticut is
Yeah.
that, like I said, Mairead Painter, we are really fortunate to have the long-term care ombudsman that we do have. She has really pushed forward a lot of legislation last year. And the year before, there was a lot of legislation to address a lot of these issues. A lot of issues around visitation when the pandemic first started, and the results that she saw because of social isolation.
Yeah.
And ensuring that resident rights are preserved, and we've done a lot of education. Yourself and I have done education to I've done some education series with other attorneys to really try to make sure that those rights are preserved. But we are a leader. Connecticut is a leader in that regard. So we should be proud of that. That we have someone who's a really strong advocate.
I just wanted to point out that it's like someone has asked, is it lack of social workers due to funding or available accredited folks, or both? Both. But I also think it's such a huge issue. Unfortunately, the for-profit nature of nursing, skilled nursing facilities, and healthcare in general, but skilled nursing facilities has meant that corporations have a lot of non-transparent things going on behind the scenes where they're essentially laundering money. And that is part of why services in skilled nursing facilities are not what they should be. Staffing is not what it should be. And really, unless there's going to be federal legislation to say you cannot keep having these corporate ownership, then the other way to go about it is to keep legislating what those services have to be, and to be more in a micromanagement kind of, we really need this, we really need these, LPNs, we really need more aides and, CNAs to do the work, because it does seem like there's a lot of shortcutting going on if things are not as clear.
Yeah, and I think those of us who have worked in skilled nursing facilities can attest that it is not an easy job.
No.
I grew up, and I think things have changed a lot. When I was growing up, my mother worked in a nursing home. She was a CNA. And I got a job there when I was in high school and college and law school. And so I was there for quite some time.
Yeah.
But it was always families. There was a lot of families that worked there. So it was a different environment than I think it is today. And there was also a lot of more incentives. So one of the incentives I had to stay and work at a nursing home, even though the work was kind of hard, is I got paid at the time fairly well for a high school kid. And then I also got college tuition reimbursement.
Wow.
And so when I went to UConn, I graduated, I had like a $4,000 loan. So, I mean, that's nothing. But they don't offer those types of incentives. I had to have a major that was, related to the healthcare field to do that. But I think we need to build the workforce with some incentives. So when people work in that area, maybe they say, gee, I really like working with older adults, which is what happened to me. I fell in love with the population. And then I didn't really plan where I was going with this, but I was able to build on that. And so, the workforce issues are just tremendous. It's a hard job for sure.
Yeah.
But very rewarding.
Yeah. And there's actually been some really interesting qualitative research done on like I mentioned earlier, that, geriatric social workers, there's so much different work you can do in social work. But oftentimes, folks that, start off or at some point in their career go into aging tend to stay. It is extremely rewarding and there's lots of opportunities. Those two things are great. At least it's been great for my career. And so just want to ask, and I think Lara, you mentioned some of these things, but I'll ask the two other panelists. We have a few minutes. What are some of the emerging or worsening challenges that you've seen since starting your work? What kinds of needs do you see increasing for older adults in Connecticut? Just, I know you talked about grandparents, so if you want to focus on that, that'd be great.
Yeah, I think Laura really hit it. I mean, housing, I think, really comes up as a huge need, not just for our grandparents, but all the families that we work with at the Department of Children and Families. Unfortunately, that's one of the huge needs. I saw in the chat that there was a question about children entering care and how do we address trauma, and is there service provision around mental health and behavioral health? And the answer is absolutely yes. One of the great things is that in Connecticut, we're really resource rich when it comes to mental health and behavioral health services, and any service that a family that's come to the attention of our department, any service that they can receive, a caregiver can receive as well. So a grandparent can receive, a core foster parent can receive, and we have services that can come in your home. We have, of course, we can refer to services that are out of home as well.
Thank you. So Rachel, what are some of the emerging or worsening challenges that you've seen since starting in your work, and what kinds of needs do you see increasing for older adults in Connecticut? And, I'm going to ask, and how can social work really respond to that?
We've talked about housing being an issue, and it definitely is, right? There's a humongous lack. And that is something that's very frequent, I think, on a daily basis is an issue I come across. But to kind of go off of what Tina was saying as well, we as a state, and it's not just our state, right? Federally, we're in a behavioral health crisis. And the pandemic really exacerbated that issue, right? And especially for our elders, right? So folks who either had pre-existing mental health and substance abuse issues, or, these were created by the pandemic, elders who were hit super hard. So we all managed that isolation by Zooming, Skyping. We went for walks. We found outdoor activities that we found solace in, that we can do with friends and be a bit safer. Our elders, a lot of them were not able to participate in these activities for a myriad of reasons. And this really caused substance abuse and mental health to really spike with them. But the problem is we don't have a great solution for it, right? So now this has spiked. It's totally a crisis. And what we have set up in Connecticut, and again, it's a federal, it's a national issue, but in Connecticut, we don't have great treatment for elders in these areas. So looking at substance abuse, there's so many barriers. You cannot go to detox or rehab if you have Medicare. What do you do, right? You private pay. Okay. So if you are one of the few folks who can afford to private pay, which looking back at the data, right, you were reviewing in the beginning, Rupal, that's a very, very small percentage of the population. If you can't require any hands-on care. You can't have any cognitive deficits. You can't use a cane. You can't use a walker. Can't be wheelchair bound. Can't need any assistive devices or durable medical equipment. How many elders are really able to get substance abuse treatment then? It's minute. And there isn't a great solution for that, right? Right now we're focusing folks on IOPs and utilizing the hospital systems. But as we know, hospital systems are overrun right now, right? Having to go to the ED so you can go inpatient to detox from alcohol safely is far from a great plan for the hospital system, for the individual. That's not the treatment they need. And so it's a work in progress. I totally agree with Tina that as compared to other states, Connecticut we're doing pretty amazing with behavioral health, and we do have a lot of resources, but it's still a challenge and it still needs to get better. And the same thing goes for mental health. So many folks gave up private practices when the pandemic hit, and haven't returned to that. It is more lucrative to work from home. You're not paying for the rent and the utilities and the insurance, but this isn't necessarily accessible for elders. It requires an understanding and knowledge of technology. It requires owning the technology, right? And there's also visual and hearing issues that can be involved. So it's not an accessible option. There's also a bit of a difference in preference. So if you ask a younger individual, a lot of folks totally fine with telehealth. But my patients who come to me looking for a therapist really struggle with building that trust, building that bond over a computer screen. Many will say to me, well, just the first 3 or 4 visits could be in person. Then I could do telehealth from there, right? But it's not an option. And so it really is a challenge. We do have great clinics throughout the state, like Wheeler, Wellmore, CHR, Intercommunity, but their providers aren't necessarily specialized, educated, experienced in elder care. And it's a different stage of life. It's very unique. And how depression and anxiety can present in this age group is different, perhaps, than a younger individual. The types of medications we can prescribe to manage these symptoms is different. So, and again, we don't have great solutions to these issues. But huge problems and a growing population. It's a great area for social workers to get involved in, to be specialized in geriatrics, to become certified dementia practitioners in addition to their clinical licensure, and work as therapists with elders, right? We need to increase that population. People who do in person, there are some folks who are starting now to come to folks' homes, right? They don't have an office, that's okay. I will come to you. We need to continue increasing the amount of colleagues who are able to do that. And those of us who could just advocate for increased providers in substance abuse and increase that accessibility is huge.
Thank you. Thank you for mentioning some of the issues that have emerged and been exacerbated since COVID. And yes, I think all of us are seeing that in our practice and our work with older adults, and really the need for social workers to show up. And as much as we, have kind of become accustomed with people in our age cohort, working online and doing those things, but we really do need to show up for our older adult population that really want that one-on-one contact. And so thank you for mentioning that. I appreciate that. So now I'm going to open it up for Q&A from our audience. And Katie, I think you're going to go ahead and start.
We have one questioner earlier who asked again of, let's see, oh yeah, here, Rachel, about how many clients you work with on average and how long, and you kind of talked to that a little bit. What I wanted to ask even kind of more particularly, so you're working with the outpatient service, but how are you referred to see someone? Because I know from experience, I didn't get to see you when I brought my dad to that outpatient service. So there must be some criteria that they're using.
There is. So typically it's up to the provider to determine that there is a social need. And so they will refer, I have a queue I more or less work out of, and they refer them to me, although folks I'm always accessible to. We are a growing practice. We're reasonably new in the grand scheme of things. Our goal is to be able to have such a strong social workforce that you have your first visit, we're able to come in, do a biopsychosocial right then and there. Let's determine where you have needs, right? What do you need, caregiver? What do you need, including SNAP, behavioral health issues, home care? Do you have an advanced directive, right? Building from the ground up. Until we have that ability, it is a consult service.
Yeah.
Um,
It's a lot like working in a hospital, except it's outpatient, because
Yes.
often that's the same way hospital social work works. Yeah.
Right. The big difference, though, that I'd love to share to my inpatient colleagues is that once I'm your social worker, I am always your social worker, right? So
fabulous.
you need me that one day because you have a question about applying for Medicaid, or like today, the past couple of days, I've been dealing with the daughter of a 101-year-old gentleman, amazing, who has been residing at home, fell in a short-term rehab.
Right.
What is this going to look like? The social worker at this facility is totally overwhelmed, doesn't have the resources and time to sit down with her and say, these are the different options. And this is what Medicare is going to do. This is what Medicaid's going to do. Let's talk about the 5-year look back of Medicaid. Is that a 2-person assist? Do you need to do a Medicare appeal, right? To really break it down with her. So each day we've been touching base. How did the appeal go? Okay, what wait list did you put yourself on? And kind of just chipping away. And it's a day by day, different needs come up. So for some folks, they consult me once. Other folks, we run the gamut to answer Joy's question. I may speak to them every day. It might be once a week for months, for a year. And then that relationship ends. But when they need me again, if they do, they're able to contact me. It's not a one and done, because the beauty of what I think we all love about working with elders, like Rupal saying, you go into it, you stay, is that we love working with them throughout the lifespan, right? Developing that relationship, guiding them through, and helping them to use their strengths, right? To live that life, talking about dignity and self-determination that they want. So I'm always there. So the number of people I assist, Joy, some days I could maybe only get 5 referrals. Some days it's 15, but all of my patients are always all of my patients, and I'm always their social worker available to help.
Yeah. That's really interesting. That's very nice. It's nice for the people who are lucky enough to get into that with you. That's wonderful.
And could I ask a follow-up question? Do you guys assess for loneliness or social isolation?
So our providers do, and they do make referrals for that.
Right.
Those are the harder folks to contact. I am limited unless you come to our Farmington campus. I am limited over the phone. I don't do in-person visits. And so that's a challenge with elders, right? Getting in touch with them and motivating them to do things that might be outside their comfort zone. But it is something our providers are screening for, and luckily can consult me, and we can talk about all the different options of how to decrease those symptoms and problems.
Nice.
Great.
Thanks. Another question from our viewing audience and listening audience. What is your connection for anyone here? Do you have connection or collaboration with senior centers? I'm not sure all of you would, but who would like to answer? Lara.
The State Unit on Aging is strengthening our relationship with senior centers. We've always had some relationship with the senior centers, but in the last legislative session, the State Unit on Aging was given funding to hire someone to be a liaison between the State Unit on Aging and the senior centers.
Wow.
So I had to laugh because I've done a little work with Jennifer. I'm also working with the senior centers statewide, along with one of my coworkers. We received funding through the American Rescue Plan to fund and provide support, financial support to our senior centers throughout the state. That's a lot of senior centers, so it's taking a little time to organize that and get that funding out. But that's really what we are doing. And we recognize that senior centers are really vital and, central point for information and referral services. They are very often nutrition sites, and State Unit on Aging funds a lot of nutrition programs that are located in those sites. So we really know that there's a lot of value in supporting the senior center. So I'm glad that we're able to better support them, and we'll be able to better support them in the future. It's a partnership that, is probably a long time coming, but we've had some really good advocates within the senior center community that pushed for that. So and with the pandemic, I think we really saw what an important role they played.
Yeah. And the senior centers get a lot of their funding from the Older Americans Act as well.
Yeah.
Yeah, as well as city and county.
Yeah, they have funding through, and maybe it depends on the municipality, but they all have their individual budgets.
Right.
And depending on what town you're in, you may get $2,500 a year, or you may get $250,000 per year. And so there's a real disparity there between what they have to work with. And so some of the American Rescue Plan funding that we've gotten is going towards attracting more individuals to the senior center facilities and to improve programming, because it really is a gateway for people to go to the senior center and then get that information. There's so much more that's there that once they get there, hopefully they'll avail themselves of what's available to them. Yeah.
Yeah.
Tremendous work during the pandemic. The senior centers continued to reach out to older adults, having events in the parking lot. The staff were all at the senior center reaching out to older adults throughout the pandemic. At the School of Social Work, we had a program where students, through a field placement, were reaching out to older adults, both in senior centers and in nursing homes. It was a field placement for the students during a challenging time when we were having a difficult time finding field placements for them. So it was and it was wonderful. So those students called older adults on a weekly basis and did some reminiscence therapy and life review with those older adults that were not able to go to the senior center, and even folks in nursing homes, which we know in Connecticut we're extremely socially isolated, like in most states, but in Connecticut we lost a large number of older adults in skilled facilities. So our students were reaching out to them.
There's really no end of possibilities. I mean, when you think about it, for social work, if you want to work with older adults, there's so many facets of it that I think people could work in and find it very satisfying. We also work with the area agencies on aging that provide a lot of the services around the state for older adults. And we also work with another group that I'm also working with that did a fabulous job, are the elderly nutrition providers, who were providing not just home delivered meals, but congregate meals, and had to immediately switch gears and start, during the beginning of the pandemic, start providing home delivered meals, and sometimes 2 meals a day, weekend meals. I mean, they went above and beyond. So, those are other areas where social work comes into play.
I think we have 2 comments, one new comment, and then a question, Katie.
Yeah, I've been seeing them. That's my job. This is my job. Allison, who's one of my scholars in aging, is reminding us to use substance use disorder or substance misuse. So I appreciate that. She has told me that on more than one occasion, and that is very
Me too.
helpful.
She's
And
reminded me, and I appreciate that. Thank you again.
yes.
Allison.
Rupal has, this is Brianna, I know Brianna, and she says, Rupal has so importantly spoken of the growing population of older adults of color before the panel. Does any of the panel can speak to this? Special services, special supports for older adults of color, or also for other minority older adult populations, especially LGBT populations. And my first thought is, well, they are definitely included in everything we've spoken about, but perhaps there's someone who has more to, think about us if there's this particular supports or focused.
I mean, I don't want to talk all the time, but I can.
Yeah, you may talk.
What Internet Aging is doing. We do have a program, which I referenced earlier. It's called the National National Family Caregiver Support Program. Too many acronyms rolling around, and it's getting late.
Yes.
But National Families a program, and that provides support services and supplemental services to older caregivers of grandparents caring for grandchildren, but also people who are caring for older adults with dementia, or also just to physical ADL needs, and they need some assistance. It can be family members who are caring for that older adult. And we've gotten some funding through the legislature to reach out to underserved communities. And we have been asking partners to refer those cases, working with faith-based leaders and minority populations, as well as LGBTQ.
Wonderful.
And those are really kind of difficult populations to break into or work with. A lot of us, we sit around a table and we look at each other in a lot of these places, and it's a lot of middle-aged white women. I mean, to be honest. And how do we work to draw people in who are different colors, different races, different backgrounds, because we don't have that understanding? And so we've partnered with some folks at Connecticut Community Care to increase those relationships. They've built some relationships with LGBTQ and faith-based populations to kind of make those connections that we just naturally don't have. We just, it is what it is. We don't know how to make those connections. So we want to make those connections, and we've done some funding around that.
That's great.
Told you at the start
Yeah.
Did you speech?
It's nice to know that there's outreach going on for that. Tina, do you have any, I imagine many of your foster parents are minorities and women of color, grandparents of color. But anything else you would like to say about that and the diversity issues?
That's a great question. I think we focused a lot on what we call our anti-racist practice for the Department of Children and Families. But I feel like when we've talked about foster parents or kinship care, we believe inherent in kinship care is the opportunity to reduce disparity, because children are already with their families, they're with people that are of their culture, they're in their communities, and we really focus on the importance of children being maintained in their family whenever safely possible, and only coming into DCF care unless they absolutely have to. And when they do come into care, being with their family eliminates a lot of the concerns around racial and ethnic issues.
That's great. We're almost out of time here. We have one last question, and any of the three of you who would care to respond. This is, how can social workers be advocates for the older adult population across different organizations? And I think Lara has certainly spoken a lot about, in your role, you're doing that work. Then it goes on to say, what has been the most rewarding aspect of your of this work according to all your personal experiences? And then we have some some information about this Connecticut Healthy Living Collective, working with senior centers on the LGBT and MSC Movable Senior Center. Oh, I see. Where it moves to different senior center each month. Oh, okay, that's very interesting. Thank you for that. But so that's, I sort of read both, but going back to the most rewarding aspects, anybody care to sort of close us out with that? And then I know we're going to hear from Jennifer before we finish off today.
I'd love to speak to the question right before it about how can social workers be advocates for the older adult population across different organizations.
Great.
That's okay.
Yes, right.
Advocating for their dignity and self-determination. I see it across the board, whether it is family members, folks in the community who are resources, providers. There's a stereotype, there's a stigma, right? That as we age, we can't make decisions anymore. We know better, right? Oh, I know better for mom. Mom's getting older. And we tend to, as a society, infantilize elders, when in fact, we should be asking them what is important to them, right? What are your goals? What are your concerns? So frequently, I have contacted by the children of my patients saying, we'd like to have a family meeting to talk about the appropriate level of care. And everyone's invited, but the patient, they're not included in this conversation. So I think no matter the level of cognitive functioning, advocating for that individual, for your patient, your client, your resident, to be involved in the conversation and to let them vocalize their concerns, their issues, their fears, their hopes, and make sure you can also educate those that you work with and make sure they understand that that is vital. And that's so important in their dignity and self-determination.
Wow. I feel like we wrote that and asked you to say it because it was like the most perfect thing, and so true. And I just really want to thank you. That's a beautiful point on which to close out our question and answer. And we're so happy that the three of you could be here with us. And I know we're going to hear from the Associate Dean, Jennifer Manuel, again.
Yeah, that was a perfect closing, actually, Rachel. But I just want to thank you, panelists, and Drs. Parekh and Adams, for this rich conversation tonight. The discussion brought to light, some really key emerging challenges experienced by older adults and their families, including social determinants of health, and how social work is uniquely positioned to address these challenges along the continuum of care. And we also know that pervasive racial and ethnic, economic, and other disparities exist as well. And so social work services and programs that all of the panelists shared tonight to improve the quality of life and well-being and prevent social isolation are critical. And I'll add as well as strategies that affect system change to mitigate disparities. In closing, we need to talk more about aging and social work. We need more attention and awareness to this area. This discussion also speaks to the importance of engaging social work students in training and education, like the Scholars in Aging program at the School of Social Work here at UConn, in preparing for work with older adults and families. So please use the chat and join me in thanking our esteemed panelists and moderators for tonight's important conversation. And before everyone signs off, please stay tuned for information on another Scholars of Aging event coming up on Thursday, April 6th at 12 noon, featuring Dr. Karen Bullock, who is from Boston College School of Social Work and will be sharing her work on health equity in aging and gerontology.